Welcome everyone. I'm excited to welcome you to today's presentation. We're going to explore the fascinating world of diseases of eye and ear. This is the first slide, and it sets the stage for what's to come. Over the next few minutes, we'll cover common eye and ear conditions, their causes, symptoms, and how they can be managed. So let's get started and delve into this important topic together. Let's take a closer look at the anatomy of the eye. The eye is a remarkably complex and specialized organ, designed to capture light and convert it into signals our brain can interpret as images. At the front, we have the cornea, which acts as a protective layer and helps focus incoming light. Just behind that is the iris, the colored part of the eye, which controls the size of the pupil and regulates how much light enters. The pupil is the opening in the center of the iris, adjusting its size based on the lighting conditions. Moving inward, we find the lens, which fine-tunes focus so that images are sharp on the retina. Speaking of the retina, it's a thin layer of tissue lining the back of the eye that contains photoreceptor cells, rods and cones, that detect light and color. Behind the retina is the vitreous humor, a gel-like substance that maintains the shape of the eye. And finally, the optic nerve transmits visual information from the retina to the brain, allowing us to interpret what we see. Understanding these key components helps us appreciate how intricate and efficient our visual system truly is, and it's fundamental to our overall exploration of eye health and vision. Let's take a closer look at some of the key parts of the eye. First, we have the choroid. This is a layer that contains blood vessels and lines the back of the eye. It sits between the retina, which is the inner light-sensitive layer, and the sclera, the outer white part of the eye. The choroid is essential because it provides the nutrients and oxygen the eye needs to function properly. Next, there's the ciliary body. This structure contains muscle tissue and is located just behind the iris. Its main role is to help focus the lens, allowing us to see objects clearly at various distances. It's a vital part of the eye's focusing mechanism. Finally, we have the cornea, which is the clear front window of the eye. The cornea not only transmits light into the eye, but also helps focus that light, ensuring our vision is sharp and clear. Interestingly, corrective laser surgeries like LASIK work by reshaping the cornea to change how light is focused, improving vision. All these parts work together seamlessly to help us see the world clearly. Understanding them gives us a better appreciation of how complex and amazing our eyes truly are. Let's take a closer look at the parts of the eye. First, we have the fovea, which is located right at the center of the macula. This tiny area is incredibly important because it's responsible for our sharp, detailed vision. When you focus on something, it's the fovea that helps you see it clearly. Next, there's the iris, which is the colorful part of the eye. Its main job is to regulate how much light enters your eye. When you're in bright sunlight, the iris contracts to make the pupil smaller, letting in less light. Conversely, in low-light conditions, the iris relaxes and the pupil opens wider to let in more light, helping you see better. Moving on, we have the lens. Think of it as the eye's focusing device. It bends the light rays so they land precisely on the retina at the back of the eye. The lens is transparent and flexible, which allows it to focus at different distances. As we age, however, this lens can deteriorate, which is why many people need reading glasses. In cases like cataracts, the natural lens becomes cloudy, and intraocular lenses are used to replace it, restoring clear vision. Finally, let's talk about the macula. This is a small area within the retina that contains special light-sensitive cells. These cells are responsible for our central vision and allow us to see fine details clearly in the center of our visual field. As we get older, the macula can deteriorate, leading to issues like age-related macular degeneration, which affects our ability to see fine details. Understanding these parts and their functions is key to appreciating how our eyes work to give us the rich, detailed vision we often take for granted. Let's take a closer look at the parts of the eye. First, we have the optic nerve. This is a bundle of more than 1 million nerve fibers responsible for carrying visual messages from the retina to the brain. It's essentially the communication highway that transmits what you see. Next is the pupil, which is the dark center opening in the middle of the iris. Its fascinating ability to change size helps the eye adjust to different light conditions, widening in dim light and shrinking in bright light to protect the retina. Moving to the retina, this is the nerve layer lining the back of the eye. It plays a crucial role because it senses light and converts that into electrical impulses. These impulses are then sent through the optic nerve to the brain, enabling us to process what we're seeing. The sclera is the white outer coat of the eye, providing structural support and protection. It surrounds the iris and helps maintain the shape of the eye. Finally, we have the vitreous humor. This is a clear, gel-like substance filling the central cavity of the eye. It helps maintain the eye's shape and allows light to pass through to the retina without distortion. All of these parts work together seamlessly, highlighting how complex and beautifully designed our visual system is. Let's talk about intraocular pressure, or IOP, which is a crucial part of understanding glaucoma. Your eye constantly produces a fluid called aqueous humor. This fluid needs to be in balance, so as new aqueous humor flows into the eye, an equal amount should drain out. The drainage occurs through an area known as the drainage angle. This process is essential because it helps keep the pressure inside your eye, or intraocular pressure, stable. Now, when this drainage system isn't working properly, trouble begins. If the drainage angle gets blocked or not functioning correctly, the fluid starts to build up. This causes the pressure inside the eye to increase, which can damage the optic nerve, the main nerve responsible for transmitting visual information to your brain. There are two main types of glaucoma we need to understand. The most common one is open-angle glaucoma. It develops gradually and often without noticeable symptoms at first. The drainage of fluid becomes less efficient over time, leading to increased eye pressure that damages the optic nerve. Because it's painless initially and doesn't cause obvious vision changes early on, it can go unnoticed. The other type is closed-angle glaucoma, also known as angle closure glaucoma. This occurs when the iris, the colored part of your eye, is very close to the drainage angle. When this happens, the angle can suddenly become blocked, leading to a rapid rise in eye pressure. This form of glaucoma can cause symptoms like pain, redness, and even a sudden loss of vision, so it's considered a medical emergency. Understanding these differences helps us see how important proper fluid drainage is for eye health. Managing intraocular pressure effectively is key in preventing the damage that glaucoma can cause. Pigmentary glaucoma occurs when pigment from the back of your iris rubs off and gets into the eye's drainage system. This pigment can cause increased eye pressure, which may lead to pigmentary glaucoma if left untreated. Certain people are more at risk for developing glaucoma. These include those with high eye pressure, individuals who are farsighted, or those who have experienced an eye injury. Long-term use of steroid medications can also increase the risk. When it comes to managing glaucoma, eye drops are usually the first line of treatment. These drops need to be used daily and help lower the pressure inside the eye. In some cases, laser surgery might be recommended to help improve fluid drainage and control eye pressure more effectively. Overall, understanding these risk factors and treatment options is key in preventing vision loss from glaucoma. Let's talk about the guidelines for coding glaucoma. First, when assigning glaucoma codes, it's important to use as many codes from category H40 as needed. This helps us accurately identify the specific type of glaucoma, which eye is affected, and the stage of the disease. Precise coding ensures proper documentation and treatment planning. Now, for bilateral glaucoma cases where both eyes have the same type and stage, there's a specific approach. If there's a code for bilateral glaucoma, you should report only that code, including the 7th character that indicates the stage. This simplifies the coding and reduces redundancy. However, if the classification doesn't provide a bilateral glaucoma code, then you should report one code for the glaucoma type and specify the stage with the appropriate 7th character. This way, we're still capturing all the necessary details accurately. These guidelines are crucial because they help us maintain consistency and clarity in our documentation. which ultimately supports better patient care and billing accuracy. Remember, understanding whether to report a bilateral code or individual eye codes depends on the available classification and the specifics of each case. Let's go over some important guidelines for coding glaucoma cases. First, when a patient has bilateral glaucoma, but each eye is at a different stage or has a different type, it's important to assign the appropriate code for each eye individually. The classification system distinguishes between the eyes, so we should avoid using a single bilateral code in these cases. Next, if a patient is admitted with glaucoma and during their stay, the stage of the disease progresses, we need to assign the code that reflects the highest stage documented. This ensures we're capturing the most severe condition the patient has experienced during that admission. Lastly, when dealing with glaucoma cases where the stage cannot be clinically determined, we use the 7th character, 4, to indicate an indeterminate stage. This character should be assigned based on the clinical documentation, signaling that the stage is unknown or cannot be specified at this time. These guidelines help us accurately document and code glaucoma, which is crucial for proper treatment planning and reporting. Let's take a closer look at the anatomy of the ear. The ear is a complex and fascinating structure designed to capture sound and help us maintain our balance. At the outermost part, we have the external ear, which includes the pinna or auricle. The pinna is the visible part that helps collect sound waves and direct them into the ear canal. Moving inward, the ear canal functions as a tunnel guiding sound waves toward the eardrum. The middle ear contains the eardrum and 3 tiny bones, the ossicles, called the malleus, incus, and stapes. These bones work together to amplify sound vibrations and transmit them to the inner ear. Speaking of the inner ear, this is where the cochlea resides, a spiral-shaped structure filled with fluid and tiny hair cells that convert vibrations into neural signals. Additionally, the inner ear includes the vestibular system, which is essential for balance and spatial orientation. Connecting all these parts is a network of nerves and channels that send signals to the brain, allowing us to interpret sounds and maintain our equilibrium. Understanding the anatomy of the ear not only helps us appreciate how hearing works, but also highlights the importance of each part in our overall sensory experience and balance. Let's take a closer look at the anatomy of the ear. The ear is made up of 3 main parts: the outer ear, middle ear, and inner ear. The first part, the outer ear, is what most people think of as their ear. It includes the visible part, called the auricle or pinna, which is made of ridged cartilage and skin. This part contains glands that produce earwax, which helps protect and clean the ear. The outer ear also has a funnel-shaped canal that leads inward to the eardrum, officially known as the tympanic membrane. Moving inward, we reach the middle ear. This begins just beyond the eardrum. Here, you'll find 3 tiny bones, called the malleus, incus, and stapes, which are collectively known as the ossicles. These bones are crucial because they transmit sound vibrations from the eardrum to the inner ear, effectively converting sound waves into signals that your brain can interpret. The middle ear also contains the eustachian tubes, which are important for maintaining balanced air pressure in your ears, especially during changes in altitude or pressure. Understanding these parts and how they work together helps us appreciate how your ear processes sound and maintains balance. All right, let's talk about the inner ear now. The inner ear has 2 main parts, the cochlea and the semicircular canals. The cochlea is really the star of the show when it comes to hearing. It looks like a tiny snail shell and contains 2 fluid-filled chambers lined with tiny hairs. When sound waves enter your ear, they set the fluid inside the cochlea into motion, causing those tiny hairs to vibrate. This vibration is then converted into electrical impulses that travel to your brain, allowing you to perceive sound. Now, the semicircular canals, which are also called the labyrinthine, are all about balance. They help your brain understand which way your head is moving and maintaining your equilibrium. So, while the cochlea helps you hear, the semicircular canals keep you balanced and oriented in space. Both of these parts are essential to how we experience the world around us.